It's the first question. Most of them are prioritization by all pediatric patients. So pediatric patients prioritization, right? Like I said, concept for you to master. I'll give you some time to see if you can answer it, and I'll answer it. Which of the following is very concerning? Buzzwords. The way I answer question is this guy, buzzwords. Words that should be ringing in your ears. That's what we call buzzwords. And when you see it or hear it, something has to come and tell you that this is what they're talking about. It's like how you hear your name, somebody mention your name. Yeah, you can identify you by your name. So we can identify certain diagnoses by the buzzwords. It tells you that's what the examiner is talking about. Okay, so which of the following is very concerning? A nurse is caring for a 3-year-old client with a sickle cell disease, admitted for crisis. But this is the question. Sickle cell buzzword, admitted for crisis, and he's a 3-year-old. You see, I've underlined all the buzzwords. And the question is asking you concerning. So there's a ask, which is concerning, case, a 3-year-old, and the buzzwords concerning crisis in a 3-year-old with a sickle cell disease. And you will write a question in your own. Or you focus about somebody is in crisis due to sickle cell, what should be concerning? You have to be sharp. I call it be sharp. This means something that can kill the patient, and you have 1 second to fix it. Every disease process always have number one concerning. There's a bunch of them, but I want you to pick the number one. And every time they ask you a question, focus on the number one. Sickle cell, what is number one? What is the problem? What is the problem with sickle cell is vaso-occlusive disease. And they have pain due to what? Ischemia. Tissue are dying. That's why they have pain. Your brain can get into trouble. Your heart can get in trouble. Your leg can get into trouble. Your stomach, your GI tract can get into trouble just by ischemia. This is what you have. Who do you think is a priority? You have 1 second. Back pain, knee pain, heart rate of that, and headache. If you watch my bishop prioritization, the best prioritization in the NCLEX word, it talk about pain. And pain, whenever you see a pain question, oh, this is what you have to write. Limb, life, and high side. If the pain is going to cause you to lose your eyes, then it's a priority. It's going to cause you to lose your limb, it's a priority. If it's going to cause you to lose your life, it's a priority. Back pain is not going to make this kid lose his life. Knee pain, you're not losing your life, no matter the severity of that. So 1 and 2 is gone. If you're in pain, you're going to be tachycardic. If you have sickle cell with crisis and you have headache, this is a neurological problem. This is stroke. So who do you want to see? Me, I'm seeing this patient. That's how you do prioritization. So number 4 is your priority. That's the patient you should see. Number 2, same thing, same strategy. Which client situation need immediate intervention? 4 clients. They are all 4-year-old. They have different medical problems. Divide it into 2. Look at the situation and what is the problem. Kawasaki. Okay, Kawasaki. And you're getting high dose aspirin, thank goodness. You good. We're fixing you. Cystic fibrosis, well, you're going to have a large of stool, large amount of it, voluminous, and you fight it too. It's okay, brother. Ask my patient, if I give you albuterol, you're going to have tremor because this is a beta agonist. It will do what beta agonist does. Tachycardia, right? Tremor, restlessness, hypokalemia, all of them. That's what it does. If you have leukemia and you have this low-grade temperature, immunocompromised patient, that's your B-sharp moment. That's your sepsis. This patient, the temperature does not need to be 102. All they need to be is 100, and they are in trouble. C number 4. You see how I make it easy? It's not easy. It's just like strategy and the content. What is the next best action? And next, you see, I'm picking words out of the question. I'm using those words, not the full question. And next is caring for what? There's a age is always very important. When they give you, change your brain to the age. 10-month-old, who became what? Unresponsive. There's no breathing. CPR. Strategy. If you know breathing, what is the next step? Don't don't do anything on their chest until you check what their pulse. Because you can't be pushing on CPR, just improve the pulse. That means blood flow. So you must check the pulse to make sure they have a pulse. If they have a pulse, then just give them rescue breath. But just because they are unresponsive and no breathing doesn't mean you got to push on their chest. How do you check a pulse in a 10-month-old? Carotid is not good for that. Femoral is not good for that. Radial pulse is not good for that. You check a brachial pulse. Number 4. Which client situation need immediate intervention? I told you it's all prioritization, and you have to be sharp and be able to answer these questions flawlessly. Like I said, check out top 10 class. You can like this video if you want. But this is the way I do prioritization. The situation and then breaking down. The name does not matter. It's the problem that we have. 4 clients in the emergency room. Divide it into 2. Look at the age. Okay, fine. Bronchiolitis, RSV. I expect nasal congestion. I'm okay with you. Laryngotracheitis. That's croup. I expect backing cough. Enjoy. Pertussis, you're going to have whooping cough. That's fine. There is no evidence of respiratory distress in this patient. If there's going to be, they will give you. Don't bring your knowledge. All they're giving you is this. So stick with it. All they told me is backing cough. No nasal flaring, no retraction, nothing. Do you recognize number 4? It's our concept and words. Pharyngitis, sore throat, and trismus and muffled voice. What do you think is this diagnosis? What does this patient have? You have to be able to put these 3 words. These are the buzzwords I'm talking about. I call them buzzwords. When you tell me there's a kid with pharyngitis, there's a kid with trismus, and this kid also has muffled voice, I know what it is because of the content. These 3 words, if I see it in the case, I can set a case for you. The examiner can create a case with these 3 words and put a meat under around it. That means it gives you so many stories. But the buzzword you should focus on is what? Pharyngitis, a trismus, and a muffled voice. That is how we study as a physicians. We look at those words and then we use it. When you tell me that you have sore throat and I saw a trismus and you have a muffled voice, I know what you have. I know what you have. And what do you think is the diagnosis? What kind of diagnosis is that? What do you think this patient have? A sore throat, a trismus, and a muffled voice? If you don't know, check Adapt in class. This is what we call tonsillar abscess. This guy has a tonsillitis that he has turned into an abscess. Trismus, he can't open his mouth. And he has an odd potato voice. That's what we call muffled. It looks like there's something in their mouth, eating food, like how you eating something hot and you make a har sound. Yeah, muffled voice. That's an airway issue. But as we did from the beginning, we clear this test taking skills. If you don't even understand this, pick this. But this is a bad problem. Tonsillar abscess. It's called tonsillar abscess. That patient has had tonsil problem and now has developed abscess. Number 4 is your boy. Number 5. Which client situation need immediate intervention? Same thing, right? 4 clients are in the ped emergency room. Intervention, immediate intervention. Same age. You can't tell me one is older than the other, right? And they have a problem. Projectile vomiting. Projectile, they vomiting. You vomiting, buzzword. This case is all buzzword. I intentionally said these questions to focus your eyes on when you're studying. You have to be familiar. Hit those buzzwords. Like, I want you to write them down. And I believe that's the best way to, if you know them, because when they give you a case, that's what they used to write it. When they give you a question, when I write a question, you see, I put it there. When the examiner write it, if you look at the Q bank, that is all. It's all buzzwords. Buzzwords, that means things, when you mention it, I know you have this. When you tell me somebody have voluminous stool, excessive mucus secretion, recurrent respiratory infection, I know he has cystic fibrosis. Just by 3 words, those 3 words, you don't have to tell me anything anymore. You tell me somebody has headache, neck pain, right? And fever, and irritation, and irritability. I know they have meningitis until proven otherwise. Those are the things you have to focus on. So, sunken eyes, right? 10-month-old, irritability, and sunset eyes, buzzword. 10-month-old, severe diarrhea, lethargy. All these things in the B sharp, but you have to think, apply your knowledge and your critical thinking. If you need that, check it out, because I deal with critical thinking. You think about the thing, not memorizing ABCD. There's no ABCD here now. Do you see ABCD? It's all thinking. So diarrhea and poor feeding. I intentionally said this question. I can tell you they are all saying the same thing. If you're projecting vomiting and you have sunken eyes, you dehydrated. This is severe dehydration, signs of severe dehydration. If you are irritable and you have sunset eyes, this is ICP, intracranial pressure problem. If you have severe diarrhea and you're lethargic, dehydration, severe dehydration. If you have poor feeding and you have diarrhea, same thing, severe dehydration. You want to pick number 1 out of number 3? You can pick 1 and leave 3. You can leave 3 and leave 4. 1, 3, and 4 are saying the same thing. I'm showing you how they can give you a dehydrated patient. They all are dehydrated, severe dehydration. Who do you want to pick? You have 3 dehydration and ICP problem. You know who you need to choose. So sunset eyes is more serious than a sunken eyes. It's more serious than somebody who is lethargic because he has ICP issue. So this guy is in trouble. But all these are problem. They are all problem. They are all problem. And you have to figure it out how to do these kind of cases. Of course, this is not vetted. NCLEX will try to be nice to you, but I want you to master it so that when they give you the easy questions, you can master them. Same thing. Concept question. 4 clients in the Peds emergency room. Which client situation need immediate intervention? Same age. Teratology or Foley, right? Tetralogy or Foley. Cyanosis when you're feeding, pictus ductus arteriosus. And a machine like mama, aortic coarctation, and +1 femoral pulses. I have a friction rub and narrow pulse pressure. Who do you want to see? Who do you think you need immediate intervention? Who is more serious? These guys, tetralogy, when they cry or feed, crying, feeding, they turn blue. This is what we call text spell. Nature's position, and then you'll be done with the kid. If you have PDA, I should hear this mama. That is the diagnosis of PDA. If you have coarctation of the aorta, if this is the baby, the pulses in the upper extremities will be like +3, and the pulses in the lower extremities will be +1. So decreased pulses in the lower extremities and increased pulses in the upper extremities. So this is what I expected. If you're a 10-month-old and you have friction rub and a narrow pulse pressure, guys, who is in trouble? 1 is fine. 2 is fine. 3 is fine. Do you recognize this? Friction rub. When you have friction rub, you have pericarditis. Let me break it down in adapt NCLEX way. This is your heart. And you have inflammation on the outside. That is pericardium. It causes constriction of the heart. You will develop constrictive pericarditis. This yellow thing will give you the friction rub, the clicking sound when you listen to them. When this becomes severe, it pushed on the heart and they develop cardiac tamponade. How do you know they have cardiac tamponade? There's a bunch of signs and nobody teach you about this. I'm telling you about this. Narrow pulse pressure is cardiac tamponade. They always talk about Beck's triad, hypotension, changing muffled heart sound, and JVD. But don't forget about narrow pulse pressure and pulses paradoxical. Most people don't know this too. Pulses paradoxical and narrow pulse pressure. What does that mean? Narrow pulse pressure. Your systolic, usually 120/70. You see, it's about 50 different. When you have narrow pulse pressure, you can get 120, 110. Somebody blood pressure like this, I'm worried about 120/110 than even 80/40. 80/40 as a pulse pressure, it can push the blood forward. A narrow pulse pressure, that means your systolic and diastolic are closer to each other. There is no pushing of blood. Blood doesn't go anywhere. Tell me your heart is not functioning. Narrow pulse pressure is an indication of a tamponade in this situation for a friction rub. So this patient is not happy. Is not happy. That patient is not happy. Number 7, a nurse is caring for 4 clients. Which client situation need immediate intervention? Same thing, 5-year-old, nephrotic syndrome and periorbital edema. This is no brainer, right? That's what you expect. Acute glomerulonephritis. What do you expect when you destroy your glomerulus in your kidney due to strep infection? This is secondary delay infection from strep infection. You get a tea-colored urine. When do you worry about this problem is when they have hypertension. Nephrotic syndrome, acute glomerulonephritis, it becomes a priority, a B-sharp moment when they have hypertension. But if they have tea-colored urine, they have periorbital edema, don't worry about it. Ray syndrome, yeah, acute liver injury. You're going to have encephalopathy. How do I know? Your ammonia is elevated. So this is fine. If you have a worm's tumor, this is catecholamine VMA, it's catecholamine, epinephrine, no epinephrine tumor. If you palpate it, you're going to release them into the system. And we're going to have hypertensive crisis. New graduates, you are in trouble for multiple palpation of the abdomen. I got to go see these patients. Number 4 is your answer. Number 8. 4 patients. You want to see pyloric stenosis. You have a BU of 20. I know your problem. You're vomiting and you dehydrated. Normal BUN is 20. That's why you have 20 to 1 is the ratio. Creatinine is always 1, BUN is 20. So the ratio is 20 to 1. This patient, creatinine probably is 2, dehydrated. Intussusception, I should not be seeing large brow stool. What should I see? Current jealous stool. That means you have intussusception. If you have brown stool, oh, thank Jesus, you're normal. If you have brown stool, that means your intussusception is resolving. So there's no problem with you. The word intussusception does not matter anymore so far as you having brown stool. You are being sharp and using your content that if I shouldn't see, like I told you, every problem as their diagnosis that you should worry about. Intussusception, worry about current jealous stool. When they're seeing that, that means they have ischemia. If you see brown stool, that means they're good. That means they're good. Rheumatic fever, worry about joints. And that is joint problem. It's not the problem. That's your diagnosis. And I have cystic fibrosis. And you've seen this already. Cystic fibrosis patient with a lot of diarrhea. Now you have sucking eyes. That's dehydration. It's not good. Now, these words are sucking in your eyes now and your ears. So when you see it, you know, we are worried about it. Severe dehydration. Number 9, we're almost done. A nurse is reviewing phone call from 4 clients. Which client situation need immediate intervention? They are Marfan syndrome. They are 5-year-old. So there's no problem. Marfan syndrome, 5-year-old. This is to tell you, you need some content. Marfan syndrome, what are you worried about? They have aortic problem that can dissect. Because of that, no contact sports. If you are female, you can get pregnant. No pregnancy because of aortic dissection. Marfan syndrome, I expect scoliosis. Marfan syndrome, I want you to take antibiotic for dental problems so that you don't develop endocarditis. Marfan syndrome, you cannot go to a youth club. No way, camp and play football. That's a contact sport. you're going to die. So Marfan syndrome, your lens is moving around, so you need to see ophthalmology. But you're not going to football camp, sorry, you are in trouble. So this patient needs to be seen or called back. And the last question, Kawasaki, my favorite. Which client situation need immediate intervention? And nurse is reviewing phone call for 4 clients. Who you want to see? What is the problem with Kawasaki? The same thing. Small, medium-sized vessel. And they can have aneurysm. What is the key part? 5 days of fever. That's why we treat it with aspirin and immunoglobulin. So far as you having fever, that means you develop aneurysm. I don't worry about your joints because it's not a problem. I don't worry about your strawberry tongue because it's not a problem. You're going to get tired because you're not eating. But so far as you're having fever at home, when your mommy call that you're having fever, I know that you are at risk of aneurysm and we're going to get into trouble. So aneurysmal malformation is ongoing so far as you have fever. The idea is to break the fever. So if you still having fever, yeah, I got to see you. And that's the problem. Peds prioritization. You see, it's not hard, guys. I know you guys can make it. Thank you for watching and all the best of luck. Adapt NCLEX out.